بسم الله الرحمن الرحيم. أعزائي الطلبة، السلام عليكم ورحمة الله وبركاته. Our lecture today about white blood cells or leukocyte as term. White blood cells or leukocyte represent the immune or defense system mechanism against infective pathogen. It's classified into granulocyte, and this is granulocyte to neutrophil, eosinophil, basophil, and other class, which is agranulocyte, includes monocyte, macrophage, and lymphocyte, which is T and B lymphocyte. Also, this type of blood cells, white blood cells or leukocyte, can be divided into two groups, phagocytes and immunocytes. Granulocyte with monocyte comprise the phagocytes, while the lymphocyte, which is T and B lymphocyte, and the plasma cell comprise the immunocytes. Only mature leukocyte present in the peripheral blood. This picture shows you different type of white blood cells, granulocyte and agranulocytes. Other picture to show different types of white blood cells. And this table shows you the normal blood white blood cell count for adults and children. For children, it is differ from units till the childhood, decrease with time. Units represent 1 month age. Neutrophil, starting with commonest type of blood cells, has a characteristic dense nucleus consists of 2 to 5 loops. Pale cytoplasm with an irregular outline, contain many fine pink blue or gray blue granules of the lysosomal origin. Lifespan of neutrophil is in the blood circulation only from 6 to 10 hours. Eosinophil, similar to the neutrophils, except that the cytoplasmic granules are coarser and more deeply red staining. As you show in this picture, there are rarely more than 3 nuclear loops. They enter inflammatory exudate and have a special role in allergic response, defense against parasites, infection, and removal of fibrin from during inflammation. Basophil, only occasionally seen in the normal peripheral blood, dark cytoplasmic granules with olivia overlie the nucleus, contain heparin, which is anticoagulant, and histamine, which is related to the trigger of the allergic reaction. And we have 2 receptors for the histamine, H1 and H2 receptors. In the tissues, they become mast cells. They have immunoglobulin E attachment sites. Their degranulation is associated with histamine release. The monocyte, usually larger than other peripheral blood leukocytes, possess a large central oval indented nucleus with clumped chromatin material. The abundant cytoplasm stain blue and contain many fine vacuoles, giving a ground glass appearance. Cytoplasmic granules are also often present. The monocytes spend only a short time in the marrow and after circulated for 20 to 40 hours, leave the blood and enter the tissue where they mature and carry out their principal function. Their extravascular lifespan after their transformation to macrophage astrocyte may be as long as several months or even for years. They may assume specific function in different tissue like skin, gut, GI tract, and liver. This is a slide represents the presence of the monocyte in the kidney, brain, and blood vessels, and lung, liver, spleen, bone marrow, and lymph nodes. The lymphocyte immunological component cell that assists the phagocyte in defense of the body against infection and other foreign invasion. Two unique features characteristic of the immune system are antigenic specificity and immunological memory. The primary lymphoid organs which lymphocytes develop are bone marrow and thymus, which is in the mediastinal region. The secondary lymphoid organs in which specific immune response are generated are lymph nodes and spleen, which is located in the left hypochondrial region. The lymphocyte immune response depends upon two types of lymphocyte B and T cells. B cells mature in the bone marrow and circulate in the peripheral blood until they undergo recognition of the antigen. B cells mature into memory B cells or plasma cells that home to the bone marrow. The T cells develop from cells that have migrated to the thymus, where they differentiated into mature T cells during passage from the cortex to the medulla of the lymph nodes. This is lymphocyte picture under the microscope. And this is the leukopoiesis, which is the white blood cell formation process from bone marrow till reaching the blood circulation. Granulopoiesis, granulocyte and monocyte are formed in the bone marrow from common precursor cells, myeloblast and myeloid cells. In the stable or normal state, the bone marrow storage component contains 10 to 15 times the number of granulocytes found in the peripheral blood. Following their release from the bone marrow, granulocytes spend only 6 to 10 hours in the circulation before moving into the tissue where they perform their phagocytic function. They spend on average 4 to 5 days in the tissue before they are destroyed during defense action or as a result of senseless. The control of granulopoiesis myeloid growth factor. Many growth factors are involved in the granulocyte maturation process, including interleukin 1, interleukin 3, interleukin 5 for the eosinophil, interleukin 6, interleukin 11, granulocyte macrophage, colony stimulating factor, and granulocyte CSF, cerebrospinal fluids, and monocyte cerebrospinal fluid. The growth factors stimulate proliferating and differentiating and the function of the cell on which they act. Growth factors stimulating proliferation, differentiation, and function of the cells on which they act increase granulocyte and monocyte production in response to an infection is induced by increasing production of growth factor from stromal cell and T lymphocyte stimulation by endotoxin interleukin 1 or tumor necrosis factor. Administration of GCSF, IV or subcutaneous, intravenously or subcutaneously, produce a rise circulation neutrophil is used in clinical practice to fight infections. The function of neutrophil and monocyte, normal function of neutrophil and monocyte can be divided into three phases: chemotaxis, phagocyte attract the bacteria, or the site of inflammation by chemotactic substance released from damaged tissues. Phagocytosis, the foreign material, example, bacteria, fungi, parasite, or dead or damaged cells of the host are phagocyte recognition of the foreign particles is added by the opposition with immunoglobulin or complements. Killing and digestion, this occur by oxygen-dependent and oxygen-independent pathway. This diagram summarizes the function of the neutrophil from the starting phagocytosis of the bacteria till the exocytosis. Thank you.